This is not about freedom or personal choice. It's about protecting yourself and those around you, the people you work with, the people you care about, the people you love. My job as president is to protect all Americans. So tonight, I'm announcing that the Department of Labor is developing an emergency rule to require all employers with 100 or more employees that together employ over 80 million workers to ensure their workforces are fully vaccinated or show a negative test at least once a week. Some of the biggest companies are already requiring this: United Airlines, Disney, Tyson's Food, and even Fox News. The bottom line, we're going to protect vaccinated workers from unvaccinated coworkers. We're going to reduce the spread of COVID-19 by increasing the share of the workforce that is vaccinated in businesses all across America. My plan will extend the vaccination requirements that I previously issued in the healthcare field. Already, I've announced we'll be requiring vaccinations at all nursing home workers who treat patients on Medicare and Medicaid because I have that federal authority. Tonight, I'm using that same authority to expand that to cover those who work in hospitals, home health care facilities, or other medical facilities, a total of 17 million healthcare workers. If you're seeking care at a health facility, you should be able to know that the people treating you are vaccinated. Simple, straightforward, period. Next, I will sign an executive order that will now require all executive branch federal employees to be vaccinated, all. And I've signed another executive order that will require federal contractors to do the same. If you want to work with the federal government and do business with us, get vaccinated. If you want to do business with the federal government, vaccinate your workforce. And tonight, I'm removing one of the last remaining obstacles that make it difficult for you to get vaccinated. The Department of Labor will require employers with 100 or more workers to give those workers paid time off to get vaccinated. No one should lose pay in order to get vaccinated or take a loved one to get vaccinated.
That was President Biden last night declaring a vast new federal vaccine mandate that would apply to 80 million workers in the private sector who work at companies that have more than 100 employees. So that was him last night. But of course, until very recently, Joe Biden took a very different view on whether the federal government could and should require vaccination. Take a listen.
No, I don't think it should be mandatory. I wouldn't demand it be mandatory, but I would do everything in my power. Just like I don't think masks have to be made mandatory.
That she's hit a brick wall with trying to convince people to get vaccinated. Mm-hmm. Is that a sign that perhaps the federal government should step in and issue mandates? And if not, are you putting the needs of unvaccinated people ahead of the needs of vaccinated people?
Well, I think the question here, one, that's not the role of the federal government. That is the role that institutions, private sector entities, and others may take. That certainly is appropriate. Also, local communities are going to take steps they need to take in order to protect people in their communities.
And of course, Jen Psaki has said the same thing. Rochelle Walensky, head of the CDC, said just as recently as July that there would be no federal vaccine mandate. What changed, Ryan?
Well, I mean, I think the contradiction there is a clean hit, for sure. I think what changed is that the Biden administration was overly hopeful in the spring, that coming out of the winter and into the spring, that alpha would recede and that we would be moving into hot girl summer. Masks would be off. Schools would be opening without masks. The cases would be down into the single digits, and this would be a manageable, perhaps endemic, but manageable disease. Then Delta came, and we're seeing 10,000 people a week die in this country, and so I think that is what changed. I think we should talk about the politics of this later, but I don't think that politics necessarily drove this. I think it was ultimately driven by the fact that this many people are dying, more than 1,000 people dying a day, and this is happening on Biden's watch, and therefore it's his responsibility. When Trump was president, we heard all the time, Trump has killed 400,000 Americans. You don't hear that active language around Biden. You hear passive language. 100,000 people, have died over the last period of time while President Biden has been president. But at some point, you would start to see that passive language move into active. Biden, I think, accepted the responsibility here and said, this is now his pandemic, and this is his response to it. What do you think changed?
I'm curious to know whether there's a change of heart about whether they think internally that this is even legal, that this is constitutional. Mm-hmm. I mean, Biden has said he didn't think he had the authority to impose a national mask mandate. He didn't have an authority to impose a national mask mandate. I don't see how he would have an authority to do this, which, I mean, I find vaccination.
Well, theoretically, I think theoretically he would probably say that he has the authority to impose a national mask mandate in workplaces, at sites, at companies that have 100 or more employees. Because what he's doing here, as you mentioned in your New York Times guest essay, which is what they call op-eds now, as you mentioned, there's the Department of Labor that is producing this rule, and they're using OSHA. And so the argument from the White House, and I think it's a reasonable one, would be that, look, when new safety issues arise, OSHA is deputized to regulate those issues. If a new chemical is identified as cancerous, you don't necessarily need Congress to come in and tell OSHA, you need to protect people from this cancerous chemical that's being emitted in these work sites. This is already under your umbrella of authorities, so you can now go and write a rule around this, and you can implement it. So, I mean, I get that. I get that argument. That could obviously be stretched in dangerous ways. But
this feels like, I mean, because certainly there are a lot of people who, so absolutely they should take the vaccine. We're all for it. It helps, it works, it's safe, etc. But for various reasons, there are a lot of people in this country who don't want to get it. It's not the majority. The majority have gotten, and I think more than 70%, but they don't want to get it. It seems suspect to me, the idea that a federal regulatory agency without any, nobody's voting on this. This is not this seems like a new policy, and one that in an ideal world you would have a legislature debate, decide, and then face the accountability for if their constituents don't agree with it. This is just telling bureaucrats to do this. And it's the opt-out that, well, you can just get tested constantly. That's going to be very burdensome for the employers. They're not going to want to do that. And also, I don't understand. I think this order would be much more defensive. It would be easier to defend if they exempted people who had acquired natural immunity via prior infection, which I was as wary of that as anyone else. But the data we're looking at shows that those people, it looks like they have pretty good protection from coronavirus. We don't know if it's better. We don't know if it's a little bit weaker. It could vary case by case, but it looks durable. It looks good. So those people who say, I don't really want to get vaccinated additionally, I would get vaccinated additionally if it was me, but I see how that's your choice, and you're not really hurting yourself or anyone else. And that they don't exempt those people seems like a mistake.
We've talked, and we've actually talked on this program before about the weird American exceptionalism around antibodies. Like everywhere else, I don't know about everywhere else in the world, but in many countries around the world, antibodies, if you can demonstrate, that you have antibodies, that counts. Like we have this weird insistence that the only antibodies that count are ones that are pharmaceutically produced. If you've got the local homegrown organic antibodies that you got from getting an infection and overcoming that infection, then that doesn't count. I think if you had that versus if you had three choices, that the testing or the vaccine, I think that is much more reasonable. But I also do think it's interesting the way that the media is and all politicians are kind of glossing over the testing aspect. I mean, one, we did not invest significantly enough in our testing infrastructure and started dismantling it really in the spring when we felt like We were 5 yards from the end zone here. So if you're going to require people to get tests, you have to ramp up the testing infrastructure. And to me, it ought to be free. Like, you should not have to pay to take a required test in order to go to your job. So these tests should be given out free, and they shouldn't be a hassle. They should be available, through your job, either at the site, or you can get them at home if you're working from home. And so to me, if that is one of the options, a free test that I think Biden said weekly, a free weekly test, that's not actually asking too much, I don't think, of people who want to participate in public activity in the middle of a pandemic. So you don't want to get a vaccine? Okay, don't get a vaccine. But if you want to continue, showing your face publicly around your coworkers, at least get tested once a week so that we can minimize the risk of transmission around you.
If they're going to have that, I agree, it should be free. Of course, the federal government has testing is like the aspect of the disease mitigation that the federal government screwed up the most from the very beginning. They shut down other people who were making tests and to have one consistent kind of they were aiming for like the greatest degree of precision when we were at a stage where we didn't need absolute precision. Right. Like a pretty good test would have been good enough given how many people were about to and then did contract COVID. They said no, it just had to be their test. They stopped independent researchers from doing things, and then their version was literally messed up. So they have squandered a lot of goodwill on that. And that testing. If we had really ramped up testing and done it right, that could have helped us a lot until we had vaccines. The other thing that I think, if you read that, obviously the requirement for 80 million employees is the big headline here. But if you read the other details of the plan, there's a new White House website where you can go to and see the other things he's talking about. I was struck by the fact that, I've often said, at least, I think vaccination is good and it works, and I want people to get it. And, you just get a vaccine once, or, maybe a booster shot later or something. It's good. Whereas the masks, I think, are more irritating daily. You just have to kind of wear them forever. It's not, it's not the hugest deal ever, but even like kids in school wearing them all day, until the pandemic is until cases are at zero, that we could never have that. Right. So it's just going to go on forever. So it would be great if the federal government was saying, and this is initially what the CDC said, right? Yeah, get vaccinated, and then you're actually quite safe, and you don't really have to do a lot of these other things. And then they kind of got spooked out of that. I think they got bullied a little bit by the media. In this plan, it says, nope, we're going to continue doing all the other stuff just as vigorously as possible. We're going to keep those mask mandates in place. And now, like, aren't you then kind of, undermining faith in the vaccines?
You're disincentivizing people from getting the vaccine, right? It can be discouraging, right? Right. Take this vaccine so that the argument that I made, so take this vaccine so that your risk of dying or getting seriously ill is diminished. Like, okay, that is a solid argument to people who are able to like step back and say, okay, actually, I would like my risk of serious illness or death to be significantly diminished. But you're right to say that we're going to get everybody vaccinated, and then we're still going to have all of these restrictions can be discouraging to some people and can send a mixed signal. We'll say, well, you were saying that this worked. If it works, then why are we still stuck in this? So, but part of that is the situation with Delta, and good Lord, if some of these Lambda or Mu or whatever, some of these other variants come through that have even more, apparently have even more ability to evade the immune response from the vaccine, where's this conversation going to be then, and where are we going to be then? I wonder if we're going to look back at the summer and be like, wow, those were pretty good days. Like those.
Yeah, it'd be horrible.
Yeah.
It just, because right, it's not, this is not, I like a policy of vaccination. Obviously, I want to encourage people to do it. I want to find non-coercive measures if possible, because I think non-coercive measures, they're morally superior. They hold up better in a constitutional legal sense. And I think they're ultimately going to be more persuasive for the group of people, and not everyone who has not gotten the vaccine is some absolute, paranoid, this is the government injecting me with some people just haven't had the time. It's on their list of things to do, but they don't see it as a top priority. We could make it easier for them. You could do all sorts of things that's not that forcing them. We're in a pretty ugly moment in terms of like our politics and being divided into these two tribes. This seems to me to be turning up the tension, the dial, like really high,
Right.
and risking. Republican governors are obviously going to sue over this. Probably some employers, not most of them, but probably some more ideological employers. This applies to a lot of private companies. They might sue, and they're probably gonna have one hell of an argument to make. I'm not which I don't know for sure. I can't predict what way a high court would rule, but there's it could blow up in the administration's face, right? It is not at all impossible to imagine them saying, no, you can't do this, or you can't do it via OSHA. So it seems this is a pretty bit. We should not this was a big step to take, and I'm frankly a little surprised that they decided to do it.
Yeah, and let's talk about the politics of it for a minute. We have the recall in California coming. Democrats seem extremely confident that recall is going to go Gavin Newsom's way, that he's going to be okay. If there's a shock on election day, that and it appears that there was a surge of working class voters. Hispanic voters have some of the lowest uptake of the vaccine in California. If for some reason it drives people out on Tuesday and there's a shock at the polls, I think that could alter the politics of this. So in some ways, they're showing a lot of confidence by doing this week rather than doing it next week and coasting through the recall. I think, and I'm curious for your take on this. I think what drove this strategy was a genuine effort to push down the number of people who are dying, every week. I do think that's what's at the heart of it. But I think a bonus for Democrats, as they see it, is that it's going to trigger the right. And you're going to have some of the loudest voices who are going to come out and even more forcefully appear to be straight up, not anti-mandate, but straight up anti-vaccine, and that Democrats are then going to use that as a cudgel in the suburbs, which are now trending towards Democrats, but only modestly. If they can move the suburbs from where they are now to a 60-40, a 65-35, then I think they have a chance to really to actually maybe save, not necessarily save the House, but perhaps they even think they could save the House in the midterms if they can expose Republicans as crazy enough. Because if you will follow this debate only on cable, you would think that the country's divided 50-50 on this question. But the polling is pretty consistent that actually 70+% of people are more or less comfortable with this kind of a policy. We'll see how that shakes out over the next couple of weeks now that it's actually in place. But I think what Democrats are betting on is that this is not a 50-50 issue. Republicans are in the minority, and there's an extreme wing of the Republican Party that's in the extreme minority on this. And if they become the loudest, then Democrats can kind of identify them with that segment and use it to smash them in the suburbs. Do you think that is part of their thinking? And do you think that it could actually work?
That's very interesting. I agree that the primary motivation was just, well-intended. We want to decrease deaths. Again, I question this policy, but I think that's what they wanted to do. You're right, though, that this issue, it clearly polls well with Democrats. So the base of the Democratic Party is comfortable or indeed very supportive of this kind of thing. So why not do it? You want to give your base what they want, right? Get them excited about having you in power. So I get that. The issue with this is it goes so far. I'm concerned it's going to kind of, or I think they should be concerned rather, that it's going to very much unite the opposition. I've been having a lot of arguments with, people on the right, me as a libertarian kind of arguing with some conservative type people where I've been criticizing the Ron DeSantis approach, where he's actually prohibited private vaccine mandates, Kristi Noem, who I like her approach better, she said, well, yeah, I don't like vaccine mandates, but I don't think I have the authority to tell a private company that they can't do one. I can criticize it, but I don't have that power. I can't do that. I'm more in the Noem camp because I'm a libertarian, and I've been having very, very vocal, kind of disagreements with people over Twitter. But now you've done something that both the Noem, the DeSantis, the libertarian, like we all think that the federal government cannot and should not do this. So you almost had us kind of tearing at each other's throats, and now you've given us something. Well, we can all be against that,
right?
So that might not add up to enough people to really make a difference, but that would be, if I was warning them, I think that's a concern with what they've done.
Right, and there's also a risk in trying to inflame and trigger your opposition that it gets out of control. I mean, Boehner did that with the Tea Party. The Tea Party got out of control and overthrew him and Cantor. Yeah. Saudi Arabia thought it could handle its extremist problem by funding a bunch of madrasas in Pakistan. That they came back and swallowed them up. It's rare that look at Hillary Clinton, Pied Pipering Donald Trump into the nomination because he was going to be the easy one to beat. It's rare that you can trick reality, that you can be too clever. Outsmart reality. On the other hand, their model for this is the state of Virginia, which was a swing state for a very long time, and then the suburbs started shifting Democratic, and once it moved extremely fast because the remaining rump of the Republican Party swung wildly to the right, and that took the swing voters and the people who were still in the middle in the suburbs looked at the rest of the Republican Party that was left and were like, well, I'm not them. And so now the suburbs are just absolutely dominated by Democrats. Now you can't replicate having a defense industry and a bunch of bureaucrats living in the suburbs everywhere in the country. But you can see that playing out elsewhere. Georgia and Pennsylvania, even though Georgia's still a swing state, Pennsylvania is tilting blue, but Republicans are still in control at the state level in a lot of places. But the party's becoming much more extreme, and so I think they're ready to snap, and you could see them move quickly if the suburbs flip. So I don't know. So the last question, I guess we got to run pretty soon on effectiveness. I think that your point about there being different camps, that some people are just nervous about this and it's not about politics, and then other people, it has become part of their identity. I think that's right. And so the people who are nervous about this and have some reservations about the vaccine, I think that this will push them in that direction. Whereas the rest of them, they're really quit their job. They'll opt for the testing route. They'll fake it. They'll say they're getting tests, something along those lines. But that could take you from 70 to 80+% with the number of people getting infected every day. You can get over 90 either with antibodies or a vaccine fairly quickly. What do you think that this will, like, let's say when we're talking 3 weeks from now, we'll have seen a significant uptick in vaccinations?
I don't know. I don't know that this will lead to a great deal more additional vaccinations. What I do think will happen is you're going, because of the seasonality of this virus. I mean, that's the underlying thing. We arrive at the South gets killed in the summer months because it's too hot to be outside. So people are indoors. And then we did this last summer and this summer where we go, oh my God, look, it's so out of control. And it is out of control. But then the cases are probably going to decline on their own there. And then things are going to start possibly be looking a little worse in the other parts of the country. So anyway, it's just because of the seasonality of the virus, it's going to look like things are getting better. And I wonder if, the Biden White House is going to take a victory lap. See, oh, look, we implemented this policy and then we solved the issue. So that will be interesting to see. We'll leave it there. Thanks so much for sticking with us, and we'll have more Rising after this.